to tell you a little bit about Thermage for eye area. It's a wonderful technology that can be used to treat the upper eyelid hooding. Now, what is Thermage Eyes? It is a radio frequency technology that is used to help with skin tightening and decreasing the wrinkles around the eye area. Now, there's not many technology out there that can treat the eye area, especially the hooding of the upper eyelid and the lower eyelid lines. Many times, whether it's injections like botulinum toxin, neuromodulators, fillers, this is just to fill up the area and to reduce the motion so that the lines look less. But the actual fine lines under the eyes cannot be treated, as well as the hooding of the upper eyelid. Sometimes for young people, the hooding occurs because of the way the eye shape is, but for most people, as we age, the skin over in the upper eyelid becomes thinner and it starts to hood, or you can see that it's very thin out. So what can be done? That's how Thermage has created a special tip that can be used to treat this area, and it is called Thermage Eyes. Yeah? What it does is, by applying the shots, the radio frequency shots, it actually tightens the skin, it decreases the wrinkles around the eye area, and the hooding of the eye becomes less. So all in all, the eyes begin to look bigger, you look fresher, and you don't look so down and droopy. The best part is there is no downtime whatsoever with this treatment. Immediately after the treatment, you can go back to your normal routine. How many times do you need it? Most patients would need one time at least, but if your hooding is really quite bad and quite advanced, you would probably need to have 2 sessions 6 months apart. Cannot do it closer to each other, closer than 6 months, because you need some time for the collagen to remodel and to regrow itself. When after treatment, the eyes may look immediately lifted, or it may take up to 2 weeks to start to see, but this improvement continues on up to 6 months after. So you do at that time, if some people see an immediate lifting, some have to wait about 2 weeks to see it, but it continues up to 2 months, up to 6 months. Okay, is there any bruising or swelling? Yes, there could be a slight swelling, which is quite unnoticeable. Sometimes if it's bad, it looks as if you just had a bad night crying, but otherwise there's rarely any bruising. I've never seen any bruising occur before. There's no need for sutures, and there is usually no marks on the skin at all. What is it good for? It is good for upper eyelid skin that is very thin out, lots of wrinkles, thin skin, and also eyelids that have started to droop. We call it hooding of the eyelids. Sometimes it's gone to an extent where the eyes begin to look small. Okay, and how does it work? It uses radio frequency, and this radio frequency is a monopolar radio frequency, and therefore it goes in very deep. Each shot will transmit enough heat to heat up the collagen up to 56 to 60 degrees, in which case there is new collagen remodeling that occurs, there will be contraction that occurs, and then the collagen will start to regenerate after the treatment. How long does the results last? It can last from a year up to 3 years, depending on how bad the hooding was in the first place, the degree or the severity, and if you do one of double session, it can last up to 3 years. Anything to prepare? Not really. You decide when you come in. A special eye shield will be put onto your cornea to ensure safety and non-injury to the cornea. And you come in, there's no need for anesthesia, there's no need for sedation. The treatment is about 45 minutes. Immediately after, you're fine, you can go back to your normal routine. So we're going to do a treatment in a while, and we shall see how it is done. Thermage Eyes is a treatment using radio frequency, monopolar radio frequency, to create skin tightening around the eye area. The procedure involves first tracing paper onto the skin to create squares to show the markings where the Thermage tip is going to be applied to and where the shots are going to be made. After that, eye drops given to the eyes that helps to numb the cornea area, and then a corneal shield is applied in order to protect the cornea from any potential risk of the radiofrequency applied. Once the corneal shield is inserted, we then start the application of the treatment, and the patient will then indicate the discomfort or comfort level. We try to have a level 2 for the heat that's generated, and finish off the shots along accordingly. When it's done, the corneal shield is then removed, antibiotic ointment is applied, and then we put the corneal shield on the other side, and the same system method is then applied.